Hi, my name's Manoj Krishna. I'm a spine surgeon. And today I want to tell you the story of this 63-year-old gentleman who presented with 28 years of back pain. As you can see from the arrows, he had degenerative changes at two levels in the low back at L4-5 and L5-S1. And he had tried and failed the non-surgical options available. We therefore treated him with a posterior lumbar interbody fusion, where we take out the discs and put cages filled with bone into the disc space, and then put some screws and rods at the back. He also had a spacer at L3-4. Here's Ron telling
Hello,
his
Ron.
own story.
Hello there.
So, Ron, tell me how old you are
63.
and what sort of work do you do?
A sheet metal worker.
Okay. Tell me a story about your back pain, when it started.
It's approximately 25, 28 years ago since I first went to an osteopath about it.
Do you remember how it started? Did you hurt yourself? Or?
No specific thing, I think. I mean, I was driving heavy goods at the time and obviously carrying on underweight sacks all the time, which I suppose had something to do with it.
Okay. And you've had this pain now for 28 years in your low back. And how did it affect you and your family?
Sometimes when it was bad, it was very bad. And obviously I couldn't do very much myself, apart from sit on a chair and wait for it to go away, like.
Okay.
But, I've had a lot of painkillers the last few years just to keep going. A lot of other treatment with.
What sort of treatments have you had for it over the years?
Well, over the last about 8 years now, I've had an inversion table that I've been using just to keep me mobile. TENS machines that I've used quite a bit of. A massager chair. I have an hour's program usually before I go to play golf to make sure I'm lucid enough. But, that's what I've been doing for the last 8 to 10 years.
And lots of painkillers and
lots of painkillers,
physio exercises and so on.
Yeah.
Okay. So you saw me and we found that you had two worn discs in the base of your spine. And we've done a posterior lumbar interbody fusion about 3.5 weeks ago.
Yeah.
So please talk me through the surgery and how you are now.
I wasn't particularly worried about the surgery because I obviously had a fellow at work that had gone through the same thing with you, and his comments were very positive, so there was no worry about it. I did wonder if the pain would go. The surgery went very well, the recovery went very well. It's quite amazing to wake up after surgery, or a couple of days after, and realise there was no pain there.
Wow.
And it's been the same ever since. So to be quite honest, I'm up and moving, job.
So the pain you've had in your back for 28 years, that's...
It's nothing there at all.
Wow.
Nothing at all.
And you're walking 2 miles per day? And,
quite easy.
And
quite
you're
easy.
only 3 weeks from surgery?
Yep. So really up at moon with it. Over the moon.
Okay.
Why I waited all that time to have it done, I don't know. But, I'm really pleased they have it done now.
Was there a lot of people telling you don't have surgery or because, were you scared about it? Or were they scared on your behalf? Or
because it had been a long time, there weren't a lot of advice to have it done. Obviously, after 28 years, I think I got the impression that I had to prove with it, and that was it.
Yes.
But to say that after John had had it done at work, especially seeing it was the same thing, I thought I ain't going to lose nothing.
I mean, so much has changed, and I'm delighted that we've been able to get that sorted for you.
Unbelievable.
Thank you very much.
Thank you.